Good day, I'm Dr. Evany Lambito Alisa de Besa, and we will now be discussing another mental disorder which is common among anxiety disorder. That is panic disorder. So what do you know about panic disorder? Or have you experienced someone having panic attacks during presentations, during exams, or any situations that can actually trigger? Because actually in panic disorder, there is a sudden symptoms that occurs even though without any reason at all. So what do you need to know about panic disorder? So panic disorder can actually be biological causes. So there is imbalances of neurotransmitters such as serotonin, norepinephrine, which are common neurotransmitters on when we discuss about anxiety. And panic disorder is among those anxiety disorders that are actually commonly experienced by people, especially nowadays that we have experiencing a pandemic, which is the COVID-19. So we are actually having this feeling that something might happen that can actually give fear to others, and it can trigger anxiety disorders that people actually haven't experienced before. So in panic disorder, there are a lot of symptoms, signs and symptoms that you can actually experience. So we can actually experience head to toe signs and symptoms, and people actually experience it suddenly. So like for example, there is lightheadedness or headache, or the feeling of dizziness, and then the person can have experience feeling of difficulty breathing or shortness of breath, and then feeling of choking. May others feel in layman's term ginalook, or do hindi ka ginhawa, ginasmother, something like that. Okay. So other symptoms such as person would actually feel nauseous, or there is stomach upset, chest pain, also numbness, and then diaphoresis or increased sweating, and then tremulous hands or feet, and then after that there is a feeling of impending doom, na others would think na gina-heart attack sila, or iniisip nila na aatakihin sila sa puso or mamamatay na talaga sila, kasi yun yung feeling para kasi siyang nagmamask siya if ever there is negative results with the laboratories and diagnostic tests. Then the person could experience feeling of having a heart attack, but that is actually panic attack. So others would think that they want to run, they want to disappear. They have those fear that within a month that person would think that their apprehensions, when will it happen again. So usually others experience panic attacks every day, every other day, or others are once a week or seldom. So usually in panic disorder, there are severities. Usually take the HAM-A scoring, the Hamilton for Anxiety Scale, in order to know if there is alleviations of the panic attacks, and the person would experience relief, especially when the person have been started with medications. Usually, the medication is anti-anxiety, okay? So anti-anxiety medications usually would take effect by 1 or 2 weeks, or others would take effect by 4 to 6 weeks. So it depends on the body. So we usually give other adjunct medications such as benzodiazepines like alprazolam, which is commonly given to patients who have panic attacks. There are a lot other medications were given depending on the situation and the comorbidities of the patient. So it differs with the age, with and underlying medical conditions of the patient. So it's really better that the person would seek consult with a professional, so psychiatrist. So when we say panic disorder, there are also a lot of things that you should know about panic disorder. So panic disorder can actually be sudden. I have actually experienced that. I mean, I have met a lot of patients who are actually having symptoms about panic attacks. And usually these patients go to the emergency room in order to have them checked, especially like ECG or the electrocardiogram is taken in order to see if there is a heart problem, and any diagnostic test, checking of the oxygen saturation and other vital signs in order to see if there is really an organic cause. And then after that, the patient was actually cleared. There is the internal medicine would actually clear the patient with any medical conditions, and the patient would wonder what really happened. So psychiatrist comes in. We discuss it to the patient that the patient actually undergoes panic disorder. So when someone experiencing panic disorder, that person would think it's the end of his or her life, and there is actually changes with the behavior of the patient. Like for example, if panic attacks happen during exercise, like for example jogging, then the person would avoid that kind of exercise. Or if the person would have increased anxiety due to increase of intake of coffee or caffeine, and then actually smoking can trigger, study shows that smoking can trigger anxiety attacks. Or like for example, if you don't have anxiety before, but then you started with smoking cigarettes, and then you increase the dose of your cigarette smoking, your panic attacks, your anxiety disorders can actually be triggered. And then increasing, actually, others think that someone will be relaxed if one would smoke again. But study shows that if you already have anxiety disorders, smoking can actually increase the symptoms of anxiety. So smoking must be avoided. So other symptoms that patients actually experience and they seek consult at the outpatient department, they usually feel these palpitations or pounding heartbeat, and then the patient would actually fear of going crazy and the fear of dying. Because those person who have panic disorder, the most common problems is the negative automatic thoughts that they think that they will actually die or they will experience heart attack. And that is why one of the management of panic disorder, aside from medications, is therapy. One of those effective for panic disorder is cognitive behavioral therapy. So what we do with regards to cognitive behavioral therapy is during the session, CBT usually average of 12 sessions. So during the session, we let the patient do a journal, and they put some event, and then what triggers those anxiety, and then what are those automatic thoughts that patient think during that event that causes those feeling of anxiety, fear, or the feeling of having a heart attack. So, and then that patient would know the pattern. Why is it those symptoms appears, or the patient would actually experience those physical symptoms and then behave in a way that really makes him feel panicky. And then, so panic attack is actually one of the dreaded anxiety disorders under panic disorder. So that's why we actually have a lot of patients who go to the outpatient department. So we actually have other alternative ways in order to overcome anxiety. That is breathing meditation. So I have actually prepared a video for you to practice breathing meditation. You only have to listen on the breathing meditation. You don't need to watch it. You have to listen for the instructions, and you have to find a suitable place for you to relax, and then that place must be dimmed with dim light. I mean, there must be silence, and the person will actually listen to the breathing meditation and apply it to him or herself. Okay, aside from breathing meditation, you can do emotional freedom technique in order to overcome panic attacks and under panic disorder. But actually, during panic attacks, if the patient is undergoing therapy and the therapy was not able to control the panic attacks yet, so the patient can take alprazolam or the benzodiazepines. So aside from breathing meditation and emotional freedom technique, so you can actually have time in order to focus on your hobbies, like being with nature, like gardening, going to the beach, or you can experience nature during that time. So you have to relax. Okay, avoid vices like smoking, alcoholic drinking, and also coffee, because actually coffee can, in increased amount, it can cause dysrhythmia or the irregular rhythm of the heart. So that must be avoided also. We don't discourage actually exercise, but if that actually is the scenario that patient experiences panic attack, it can temporarily be avoided, but there are other alternatives that can make the person relax or have a healthy lifestyle. Okay, the difference of panic disorder in response to generalized anxiety disorder is during panic disorder, you actually experience panic attack which is sudden. You don't have to think a lot of things or worry a lot of things in order to experience panic attacks in panic disorder. However, in generalized anxiety disorder, you usually have a lot of worries, thoughts that can actually hinder or trigger your anxiety and can have difficulty sleeping. In panic disorder, you can also have difficulty sleeping, and you also have night awakenings, especially if panic attacks experienced during nighttime. So there are different factors that can actually be the cause of panic disorder, and it is better discussed with a professional in order to know the psychodynamics or the reason behind why panic attacks happen. So there are other reasons, like unconsciously you have things that are not balanced, like for example the superego, your conscience, your id or your pleasure-seeking self, and then your ego. So that is also one of the factors which can actually cause panic disorder and other anxiety disorders. So I have already discussed to you relaxing techniques that you can use in order to overcome panic attacks, and usually the treatment also I have mentioned that. So pharmacologically, it's anti-anxiety medications, and then therapies like cognitive behavioral therapies. Other relaxing techniques that I have mentioned is breathing meditation. Okay, breathing meditation, emotional freedom technique. Okay, and you also have to avoid certain triggers or vices that can trigger your panic disorder. So any symptoms that can cause palpitations, lightheadedness, dizziness, feeling of choking, numbness, tingling sensation. Okay, so also stomach upset, you are nauseous, you do the feeling of hyperacidity. That's one of the other reasons why patients go to the emergency room, because they think that there is hyperacidity. Others think they have ulcer. Okay, so if they have been given a laboratory request and the diagnostic test and it comes out normal, then most likely that's actually the signs and symptoms of panic attacks panic disorder with having those panic attacks. Okay, so that's why it's very important for you to know this, because in order for you not to think that you are insane, you're going crazy, because there are a lot of mental disorders that can actually manifest physical symptoms, and you can think or consider it having organic causes or medical illnesses.